Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist. And in today's video, it's kind of a continuation of a previous video about scapholunate injuries post immobilization phase. So in the last video, I gave you kind of 3 top stretches that I typically start with for patients that have come out of their immobilization phase with an SL injury. This video, I want to focus more on the strengthening phase. So this is appropriate when you've kind of completed that regaining mobility phase. Typically the tissues are healed. It's always important to check with your doctor when it is appropriate in the timeline of healing for you to start this course of treatment. So make sure that you do that before you start any exercise program. But yeah, I'm going to give you my top 3 kind of stabilization or strengthening exercises for scapholunate injuries, SL ligament injuries after immobilization, and then also after flexibility retraining. So the exercises that I'm sharing here should not cause sharp or shooting pain. If they do, please stop. You may feel a little bit of soreness, fatigue, maybe some pulling or some light discomfort, but it should not be sharp or shooting pain. Typically, I'll recommend doing these exercises maybe 1 to 2 sessions a day. You're probably going to do between 2 to 3 sets, maybe 5 to 10 repetitions, kind of going through them slowly. So the first exercise is going to be a wrist isometric exercise to work the wrist extensor muscles, especially the wrist extensor muscles on this side of our wrist, which are ECRL and ECRB. Those tendons in particular, that muscle in particular, is an SL-friendly muscle, which means that it is a muscle that helps to promote stability to that area, and it helps to kind of keep the scaphoid in a supinated position, which probably won't make sense. It barely makes sense to me sometimes, but just remember it's good for the scaphoid because it minimizes the amount of tension or stress on the SL ligament. So to do that exercise, I do think it helps to have a surface to rest your forearm on. So I'm going to do it on the armrest of my chair here. So I'm just going to kind of tilt this down so you can see. So again, forearm rested, you're going to make a loose, not a tight, a loose fist with your fingers so that your fingers don't help you with the motion. And then you're going to put a little bit of equal and opposite pressure down towards the floor on your wrist. So you want to think about this wrist kind of bending up towards the ceiling. But as you can see, it looks like I'm not doing anything. Neither hand is winning the fight. Neither hand is moving. So if you find that you're doing this, back up a little bit. You need to make the pressure even between your hands so that neither hand moves. That's the meaning of isometric. Maybe repeating about 5 to 10 repetitions, holding for 5 seconds, and you could do that 2 to 3 sets at a time. The next exercise, the second one that I want to share, is a wrist flexion isometric exercise. So similar, this time we're working a muscle on the opposite side of the wrist. We're going to try and work the FCU, flexor carpi ulnaris muscle, which is on this side by the pinky. Again, same reason why we're working this one and not the ones on this side of the wrist. This muscle over here helps to keep the scaphoid in a good supinated position so that it keeps less tension or minimal tension on the SL in general, and so it will help minimize stress to that injury while providing some dynamic stability. So again, I'm going to tilt my camera down so you can see. You're going to have your wrist in a palm up position this time, and with this exercise you do want to think about kind of pushing on probably the pinky side a little bit more than on the thumb side of the hand, just so you can really make sure you're working that tendon on the side. So again, all I'm doing is fingers kind of gently spread open. I'm going to create an equal and opposite resistance. So this time you're thinking about bringing the wrist up. The other hand is going to push straight down, but neither hand moves. We're keeping that equal and opposite pressure, probably holding for about 5 seconds. Relax, come back at it, 5 seconds, relax. And again, you can repeat that exercise probably 5 to 10 repetitions, repeating 1 to 2 sets, or 2 to 3 sets would be a good idea. And the third exercise that is helpful for stabilization of SL injuries that I want to share with you is a rubber band exercise exercise, so you're going to need a rubber band or an elastic. Probably not one that comes from like broccoli, those are usually a little too strong. Just like a normal rubber band will work. This time we're working the APL, the abductor pollicis longus muscle, which is really helpful in, again, stabilizing and minimizing tension or stress to the SL ligament. So the three muscles that are SL friendly, in case you're curious, are the flexor carpi ulnaris, the ECR L and B, and then the APL. So those are the three that usually are the most helpful in training. We want to avoid kind of the other muscles that don't really help with that or kind of move the scaphoid in the opposite direction. So with your rubber band, you're going to place it around your hand. Start with the band close to the big knuckles. Same thing on the thumb. You don't want it to be too far away. You're going to keep your fingers in this round position, keep your wrists straight, and then you're going to slowly open and spread the fingers. And this is a small motion. So what I commonly see is people start kind of going like this. It's smaller than that. You're going from an O shape to a C shape. And as you do that motion, try and spread your fingers apart as well. Just a little. It's a little movement. 10 repetitions, 3 sets would be a really good frequency for that exercise. So those are my top 3 exercises. That's clearly not an all-inclusive list. There's loads more that can be helpful. If you want more information, I would check with your doctor, get referred to a hand therapist in your area so that they can prescribe an exercise program for your specific needs. But I hope this was a helpful start. I hope this video was helpful for you. If you enjoyed it, please give it a thumbs up. Subscribe to the channel, and I appreciate that so much. Truly, it does help me out a lot. And thank you all so much for watching, and I hope to see you in the next one.